One of the key questions in predicting the course of the COVID-19 pandemic is how well and how long the immune responses protect the host from reinfection. For some viruses, the first infection can provide lifelong immunity, but for seasonal coronaviruses, protective immunity is short-lived. As many countries around the world recognize the magnitude of the COVID-19 pandemic, some seemed to put their faith in herd immunity. To unpack this for us today, we're joined by John McConnell. He's the editor of the Lancet Infectious Diseases Journal. Good evening and thank you so much for your time today. Let's talk about this idea of herd immunity or population immunity as some have looked at it. It seems to be quite a contested matter. Is there agreement within the medical fraternity and scientists on whether or not herd immunity is a thing, and if it does exist?
Herd immunity is definitely a thing, and it does develop against certain infectious diseases. But herd immunity has never been used as a public health strategy, as a way to control an outbreak of an emerging infectious disease. That's never happened, and there is a considerable controversy going on in the scientific community at the moment. But I come down on the side of those who argue that there is no way that herd immunity against the SARS coronavirus 2 can develop without there being considerable collateral damage. So I don't think allowing the virus to spread through the population unchecked so that herd immunity develops is a viable strategy at all.
Let's go a bit deeper into what then some governments effectively or health practitioners would be looking at doing. If we are to then fully buy into this idea of herd immunity, what does it practically mean for the responses to fighting COVID-19? Are they likely to be different to what they have been right now?
Well, you would, in the situation that's been proposed, you would allow younger and less vulnerable people, those without comorbidities, to go about their business and potentially catch the virus. And at the same time, you would shield the elderly and the more vulnerable. However, the big issue with that, I think, is that you would still be left with this cohort of vulnerable people. The virus isn't going to disappear entirely. And there will be potential for spillover into, even if you have a well-protected group of relatively young people, there's still the potential for spillover into the more vulnerable. And also, of course, I think another really big issue is this thing called long COVID, is that we really don't know, because the virus has only been with us since the beginning of the year. We really don't know what the long-term health impact of the virus will be. So that's why I think it's not a particularly practical or even an empathetic strategy to allow herd immunity to be your way of managing the outbreak.
Do you think that the proposal around the strategy at all speaks to a fatigue on the part of officials who have been, I suppose, on some level operating at over 100% capacity to try and mitigate the health risks, while at the same time we know that economies are being decimated as a result of the lockdowns and subsequent measures that have had to be implemented?
Yeah, absolutely. I think we're all fatigued. We're all fed up of being stuck at home. We're all fed up of not being able to go and see our friends and relatives. Governments are in an incredibly difficult position of kind of dancing on the head of a pin while they try and protect, on the one hand, public health and at the same time allow the economy to operate. So I can understand the thinking behind kind of saying, come on, let it go, and we'll just protect the most vulnerable. But the pressure that will put on health services will just return us to exactly the same position as we were in the January, February, March, April, May period of this year. do not believe that to be a sustainable strategy. And so we can talk about herd immunity, but we need to talk about it in terms of a vaccine. When vaccines become available, and I'm reasonably confident that they will become available sometime early next year, then we can start to roll them out and vaccinate sufficient people. And it won't be a rapid process, but we will now allow to vaccinate sufficient people so that the virus no longer has nearly as many targets that it can spread to.
John, let's talk about immunity passports now. What are immunity passports?
Well, this is the idea that if you have had a natural infection, or even if you've been vaccinated when the vaccines come along, that you will gain some sort of certification, whether it be a piece of paper or wristband or maybe even some sort of app on your mobile phone that says I am immune against catching the virus, against having disease, and therefore I can continue to, I can now go about my business in the way that we all did a year ago. So that's the basic principle, but there are all sorts of concerns around that related to their practicality and actually just how uncertain our knowledge is of the immunity to the coronavirus.
Effectively, it sounds like we would be a long way yet before we get to the point where people could even access immunity passports. But I suppose the moral and ethical issues that it raises are already being debated now, which can only be a good thing.
Absolutely. We need to have this debate now, because if they do become practical, and as I've said, we're going to need to know a lot more about the nature, degree and duration of immunity before they do become practical. But let's have that debate now about the moral issues around privacy, around the economic benefit, if there is one, whether it will lead to all sorts of strange, perverse incentives, whether it will even lead to discrimination and inequality. So we do need to have that conversation about the hypothetical, at the moment, hypothetical possibility of immunity passports.
John, it's been a pleasure talking to you. He's the editor of the Lancet Infectious Diseases, John McConnell.